As you know, the mobile unit came about as a result of a combination of federal funding, private foundation funding, and funding from the Kansas City Health Department Health Innovation Fund. The purpose of the unit was to add a new chapter to Dr. Rodgers' vision in taking healthcare where it is needed most, directly to the communities in school settings. And I just wanted to get your thoughts on the importance of taking dental and primary medical care services to school children and underserved communities, particularly in the district that we reside in.
Well, I think what we are seeing right now and what we see all the time in society is the need not only to have medical services, but to make sure they're getting to people. Delivery is such an important part of what we do. You can have all the greatest health professionals, all the greatest technology, but if it's not actually a place where it's accessible to people, and frankly, accessibility doesn't just mean accessible like, it's close to them. It also means it's welcoming. It also means you walk in and you feel somewhere where you're comfortable to talk and to share. I mean, you're the health professional, but you know how much of that matters. Somebody's saying, there actually is this long-term issue that's bothering me, or I have this concern, can you help me? And they feel that comfort. And so what I see this as, more than anything, is us continuing to tear down the barriers to care that we have in our city. When we talk about access to care, it really does need to be, in some ways, more focused on how do we make it so people can be the best advocates for themselves? How can we empower them? How can we make sure that there's equity? And equity really is, hey, we're giving you a chance to be in your community, to be able to get access to care. So I love it. And in a government sometimes where we're critiqued for different ways that we've elected to spend money, there is no better investment by local partners, federal, state, than something like this, and with an outstanding organization like Samuel Rodgers, where, as I often remind people, I received care as a young man. And part of the reason I can stand here today is because there were people who cared about me in the 80s and 90s. And I'm glad we're helping another generation.
Thank you so much, sir.
Thank you so much.
As always, it's a pleasure.
Thank you, Sam Rodgers, so much as well.
Thank you, sir.
Appreciate it.